And with daily case counts continuing to rise at an alarming rate, the province is introducing new measures to protect some of the most vulnerable during this pandemic.
Effective December 30th, which is this Thursday at 12:01 a.m., all general visits to long-term care homes will be paused, unless you're visiting a resident in a palliative situation.
That announcement coming from long-term care minister Rod Phillips on Tuesday afternoon. While general visits will be suspended, the province is still allowing up to 2 designated caregivers to visit each resident as long as they're fully vaccinated. In addition, residents will only be allowed to leave for essential reasons like doctor's appointments. Day absences for social purposes are being put on pause.
I do understand that these measures will impact many families, but we must remain vigilant, particularly against the new Omicron variant.
According to the province, there are currently 41 long-term care homes in outbreak, and so far 91 residents and 161 staff have tested positive for COVID-19. But there are currently no long-term care residents in hospital due to the virus. The minister says these restrictions were put in place in consultation with the province's chief medical officer of health, Dr. Kieran Moore. But one long-term care advocate says these actions should have been taken sooner, and they still don't go far enough.
This was the easiest possible option they could take by limiting general visitors and kind of, clamping down on access to these residences. But I mean, where are the mandates for N95s? Why aren't we moving faster on boosters?
Right now, 84% of eligible residents and 43% of eligible staff have received a booster. N95 masks are required, but only for staff that are caring for a patient with a confirmed or suspected case of COVID-19. And as Omicron continues to spread, there are also worries about staff shortages heading into the new year.
If they have to isolate and stay home, which is going to happen and is already underway, who is going to take care of the residents? And that is the biggest issue right now. There is no surge staffing plan currently in place.
Stamatopoulos adds that with a severe staff shortage, it's possible that essential caregivers will have to fill that gap, providing extra unpaid care and support, and she worries about the toll this could take on them. There are about 45,000 essential caregivers across the province.